Time now for Better Health. February is National Children's Dental Health Month.
And here to talk about making the experience a good one for your kids is Dr. Erica Patera. Her practice is Sweet Tooth Kids in Middletown.
Yeah.
And this is the cavity monster.
The cavity monster.
Leave him out.
What's the first thing you do to get kids to relax in a dental setting like that?
Well, it starts in most pediatric offices. It starts right when they walk in the door. So the whole office is geared towards kids. There's video games in the waiting rooms, TVs everywhere, toys and books. So they're at ease, when they walk in. There's no reason for a kid to think that the dentist is scary.
Did you go to a pediatric? I went to the adult dentist.
And I sat there, which is probably okay at a certain age, not to hurt the other dentist, but it is a nice experience. We take ours to a pediatric dentist. There's a whole playscape in there, and they think it's fun.
And pediatric dentists, we've gone on for 2 years of extra training just to work with children.
Okay.
So
when do we bring them to you?
Yeah, so our recommendation is when there's at least usually like 6 teeth or by the first birthday. So it's really important to get the kids in there, kind of like the pediatrician. You bring them in, they're not really doing much to your baby, but it's really important to be educated. Even if they only have a few teeth, we really want to take a look and make sure the parents at home are doing what they should be doing.
I asked this question off air, and please, I'm not being an idiot.
Yeah.
Like, why do I need to take care of my kids' teeth? They're just going to fall out anyway. They're going to get new ones.
Right. So, we actually see, cavities in 50% of kindergartners. It's a really rampant disease. It causes a lot of missed school, a lot of pain, suffering. The baby teeth are there until like 12 or 13 in some children.
That long?
Yeah.
Okay.
So, you need them for function, for eating, but also they're placeholders for the permanent teeth. So if you lose all your baby teeth, your permanent teeth are going to come in all the wrong places.
Oh, that's very interesting.
So we grew up thinking that, a one or two, a couple cavities, just a way of life. And actually, what you're telling us now is that there's no reason for children to get cavities. It's 100% preventable.
Yeah, it is. It's it's a multifactorial disease. There's a lot that goes into it. Sugar is a big one, which we know about, and the use of fluoride is important. But yeah, it's a preventable disease. So it's really a shame, and that's why I'm trying to educate parents of starting habits at such a young age, so that way we don't end up with that 50%.
You brought some interesting things with us today.
Yeah, so this is just a little example of how we make it fun for kids. We like to give them control starting at the beginning of the appointment. They get to choose all their flavors for the toothpaste and floss and fluoride, and that way, makes them feel like they have control. This is like a little mirror for... a
little mirror?
A really big mirror.
This is the rear view mirror on my car that we actually use for a...
But it's nice, so when the kids are laying back, they can hold it and watch what's going on.
Yeah, that's really cool.
Yeah, it's pretty fun.
This is a suggested drink?
Yeah, so this is obviously apple juice, really popular beverage for children today. It has, I think this little bottle I was reading has 28 grams of sugar. So even if it's organic, even if it's, those crazy new honest brand, whatever, it doesn't matter, has tons of sugar in it.
Tons of sugar.
We say try not to give kids any juice before age 2, but if they're really addicted to the sweetened beverages for whatever reason, try to find something that has natural sweeteners and 0 sugar. So I recommend this water a lot. It has just a little bit of flavor, no sugar, and it doesn't have the fake stuff in it either. It's not like
which is nice.
Right, yeah, so just something like that. And then in terms of brushing, we want parents brushing as soon as the teeth come in. So for the little babies, we give out these little finger brushes.
Oh, look at how cute that is. Like a little finger cut with little bristles on it.
Yeah, it's really nice. And then you can just clean the teeth. An important thing is not putting children and babies to sleep with a bottle. Even with milk or breastfeeding throughout the night, you want to wipe the teeth down afterwards, because even milk can cause cavities.
Are there better brands of toothpaste out there for kids as opposed to adults?
Not really. The only thing that's different is the flavors. It's the same amount of fluoride usually.
Okay.
I do recommend using fluoride toothpaste as soon as the teeth are in there.
Okay.
The teeth kind of act as a sponge. The new teeth, the new enamel will take up all that fluoride. But I do want to take a moment to demonstrate the amount, because that's really important. So for a baby or any child under 2, what I recommend is not even squeezing out the toothpaste. You really just dip it in to get the tiniest. You probably can't even see that. It just puts a tiny bit of color in the toothpaste.
And that's it.
That's it. Because even if we know they can't spit, so if they were to swallow all this toothpaste, it would never cause any harm to them. But it's enough to make a difference for the teeth.
You don't want to ingest too much.
Yeah, exactly.
Okay.
Toothpaste is not meant to be ingested. For a kid 3 and up, we do a pea-size amount. Nothing like in the commercials where they show that
globs.
huge. Yeah, they're trying to sell toothpaste, not
Okay, so
how important is flossing?
Very important. So I know there was some controversial stuff out there at one point, but the cavities in baby teeth especially are usually in between the teeth, and that's really the only way to do it. So
Well, thank you so much for
Doctor.
being with us.
you're
We
welcome.
appreciate it. Nice to meet you.
Thank you, Cavity Monster. Great to learn more about Dr. Patera and her practice. Head to sweettoothkids.com.
thank you.